Hi, Garrett. You can go ahead and start now.
Thanks. Good afternoon and welcome to our all-party parliamentary group. This is done virtually for the first time. So welcome to everyone. I'm coming in from sunny Swansea, and we've got participants from United States, from Harvard and from York and from London and from around the country. During these presentations, you may be interested that there's a hashtag, which is hashtag Act4 digit 4 clean air. If anyone wants to tweet out any comments or suggestions, or in fact questions about what we've done to keep the conversation going. By way of introduction, people will obviously be aware that the whole globe is gripped by the coronavirus pandemic. Something like 6 million people have been infected, with nearly 1/3 deaths, and something like 40,000 deaths already in Britain. And we're finding that research is showing a relationship between poor air quality and COVID infection and death. We're bringing that together but by way of a means to put together a strategy that as we release ourselves from lockdown, we can do it in a way that reduces the number of COVID infections and provides a healthy future for all of us. I guess many people will already know that there's something like 470,000 premature deaths across Europe from air pollution already, with something like 64,000 of those in the United Kingdom. And this period of lockdown does enable us to do research with lower pollution levels to see what the health benefits are and to wonder how we can continue with a new normal to make that happen. The research around the world has showed a very strong correlation between COVID infection and deaths, and we'll be talking with Harvard about that. It's also emerging research, in particular from Queen Mary's, showing that even short-term air pollution can give rise to higher levels of infection from a given dose of COVID from the ACE2 receptor. And also there's emerging research that pollution perhaps can transmit through particulates the virus itself. So I'd like to really thank everybody who's been involved in today, and also in putting together a sort of comprehensive strategy for government in Britain and elsewhere to adopt. There's been enormous numbers of people from academic research, scientists, businesses, MPs putting into this. So I think we all hope that government will listen to our suggestions, which are rooted in scientific evidence. So without further ado, it's my great pleasure to invite all the way from Harvard at TH Chan School of Public Health, two people. Firstly, Xiao Wu, a doctoral student who's been focused on this, and Rachel Nethery, Assistant Professor of Biostatistics. Over to you, and thank you so much.
Hey, can you guys hear me? Can you hear me? Sorry, my screen is kind of...
Yes.
You can hear me? Perfect. Okay, I can see the slides here. So thanks so much for inviting us to join this very important panel, and thank you so much for your thoughtful work on the proposed air quality strategy. It's a real privilege to be able to share our group's work with you guys today. So our team has a long history of working on nationwide studies of the health effects of air pollution in the US. So when COVID emerged, we were rapidly able to expand this work to investigate the long-term air pollution, the impacts of long-term air pollution exposure on COVID-19 mortality. So we're going to give you a little bit of background and motivation for the study that we conducted, and then explain the results that we found. Next slide, please. So of course, COVID-19 has presented a public health emergency that's at a scale that's really unmatched in our lifetimes. And as we're learning, a vaccine that's available to the general public is likely to be some time away. So in the absence of a vaccine, it's extremely important for us to identify modifiable environmental factors that increase the severity of the outcomes experienced by those who become ill with COVID-19. And that's what our work is focused on, trying to discover how air pollution impacts the severity of disease once you've acquired COVID-19. And another motivation for studying the impact of these types of environmental exposures on COVID-19 is to discern whether these types of exposures might explain some of the stark racial disparities in COVID-19 outcomes that we've been seeing here in the US. Next slide, please. So by now, most of you are probably familiar with the mechanisms that COVID-19 uses to attack our bodies. The effects of the disease are largely, though not exclusively, respiratory. In severe cases, COVID-19 causes viral pneumonia and even acute respiratory distress syndrome, which is often fatal. COVID-19 is also known to cause severe inflammation in the heart and circulatory systems. And severe COVID-19 cases and death, as we know, are more common in older age groups and are much more common in people with certain comorbidities, including cardiovascular disease, diabetes, and COPD. Next slide, please. So in our study, we were focused on the impacts of a particular type of air pollution called fine particulate matter, or PM2.5. And exposure to PM2.5 is known to be associated with lots of different health issues, including mortality and cardiovascular and respiratory system damage. So PM2.5 refers to small particles less than 2.5 micrometers in diameter, which is about 30 times smaller than the human hair. And these particles are composed of a mixture of solid and liquid droplets, and they're suspended in air. And they come from a mixture of different sources, usually including power plants, cars, planes, wood burning, as well as some natural sources like dust storms. Next slide, please. And so because of the small size of these particles, they can easily pass through the nose and throat and lodge themselves in your lungs, which is why they're able to cause so much damage, whereas larger particles can often be expelled by coughing or sneezing. And as I mentioned, it's well known that exposure to PM2.5 is harmful to human health, with abundant evidence that it can cause heart disease, lung disease, and neurological diseases, among others. And as Geraint was mentioning, both short and long-term exposure to PM2.5 are known to be harmful. Next slide, please. So as our group and other scientific groups have noted, there is a large degree of overlap in the pre-existing conditions that are associated with severe COVID-19 outcomes and the types of diseases and tissue damage that are caused by long-term exposure to PM2.5. And that's really what motivated us to study the possible link between PM2.5 exposure and COVID-19 mortality. So formally, our study hypothesized that because long-term exposure to PM2.5 damages the respiratory and cardiovascular systems, it may also exacerbate the severity of COVID-19 and increase the risk of death for those that are infected. So in our study, we used nationwide data from the US to investigate the link between COVID-19 mortality rates and long-term exposure to PM2.5. And now I'm going to hand it over to my colleague Xiao, who will give you more detail about the study design and the results that we found.
Next slide. Back to our study itself, we have created a research data platforms that's containing nationwide high-resolution data sources, including exposure data for air pollution levels, health outcomes from multiple government data sources, and a lot of potential confounders that's from various sources, for example, including temperature data and comorbidity data, and a lot of other demographic data sources that can be used for in our study. Next slide. So for our study itself, our data sources are based on the COVID-19 deaths across the whole US for each counties. The source is from Johns Hopkins University Coronavirus Resource Centers. And we also collect long-term average PM2.5 concentration levels from 2000 to 2016. It's 17 years of data. And we also collect a lot of potential confounders that can be used in our statistical models. Those data including number of hospital beds, that's accounting for the different sources of hospital, the medical resources difference in different counties. And also we account for population densities, age demographics, and racial demographics, and a lot of other resources. So next slide. So the main results for our findings is that we find that only 1 unit increase in long-term average exposure to PM2.5 in the past 15 to 20 years is associated with an 8 increase in COVID-19 mortality rates in the United States. So to be more specific, we find that consider 2 hypothetical counties. Those 2 counties are very similar in all other conditions that I have mentioned. For example, similar population densities, similar racial demographics, and similar age groups, and also similar smoking rates, temperatures. All other conditions are similar. We find that people living in one county that have 1 unit higher of exposure to PM2.5 is associated with 8% higher risk of dying from COVID-19 mortality. So this result is really consistent across different statistical models, as we can see in this graph. And next slide. As we all know, that policy and strategies cannot be made solely on one single studies. So this is a great article that summarizes the scientific evidence around these issues that include previous studies on SARS outbreaks, which is a previous coronavirus outbreaks in 2003. The scientists find patients living in heavy pollution areas are twice likely to die compared to lower pollution areas. And there are many other recent studies worldwide, including study in UK, that shows the link between long-term exposure to PM2.5 and coronavirus deaths. And also, scientists find that the coronavirus are detected in the air pollution centers. Those are all evidence that suggest a link between air pollution and coronavirus. Next slide. So our studies have several public health implications. So for example, during the pandemic, we need to prioritize counties and geographic regions that are more polluted. For example, allocating of PPE face masks to those heavier air pollution counties in order to protect people there. And we want to stress the importance of continuing regulations on the different type of air pollutions in order to protect the human health. And also we find that people of color and low incomes, people are disproportionately affected by air pollution and may further exacerbate the health disparities. So that's the questions we need to be aware as well. So, but most importantly, we need to get the science out and be heard by people. Yeah, next slide. And people who are interested in more details about our research can go to this website, and this our team. Thank you.
Thank you very much for that excellent presentation. People, incidentally, are free to put down questions in the chat box, and we'll be coming to questions at the end. And as I said at the start, feel free to tweet on #ActForCleanAir about this subject. Secondly, now I want to turn to Professor from Queen Mary University of London, Jonathan Grigg, who's the Professor of Paediatric Respiratory and Environmental Medicine. Over to you, Jonathan.
Thank you very much, and thank you for the opportunity to present some of our data to the committee. We've heard about epidemiological data showing associations between PM and COVID disease. What we've got experience of doing is trying to model whether the associations are biologically plausible. We've done this for the association between PM10 and PM2.5 and bacterial pneumonia that we see in children. And the data I'm going to present to you is work that we've been doing to establish some biological plausibility for the association for COVID disease. Next slide, please. This just is this is a published paper just to emphasize that these papers are coming out. This is epidemiological data showing perhaps more shorter term or medium term exposures up to 2 weeks beforehand associated with an increase in incident cases of COVID disease, not COVID deaths, but COVID disease. And this is from data from China. I'm sure there'll be more and more papers coming out showing these associations, but just to emphasize that we may be dealing with sort of short-term associations, but of course, given that people are stratified in terms of their exposure, long-term exposure also can be associated with disease. Okay, next slide, please. So to infect cells, and that's really critical to develop COVID disease, you've got to have infection. What the SARS virus, the SARS-CoV virus does is it uses a receptor called ACE2, the angiotensin converting enzyme 2 receptor. There's nothing special about this receptor, but it basically hijacks this receptor on the surface of airway cells to adhere to essentially the cell and then subsequently infect it. So if you haven't got any ACE2 on your cell, those cells are very resistant to SARS infection. And this is very common in viral and bacterial infections, hijacking various receptors. And we've looked at another type of receptor for bacterial infection. And it's a different receptor. Next slide, please. We know quite a lot about where this receptor is expressed. It's certainly expressed in the airway. If you look on that left-hand side, this shows the variety of cells that we're talking about. Nasal cells, the lining cells of the airway, the larger breathing tubes, the trachea and the bronchi. There's certain these cells are existing there, and down deep in the lung where these SARS-CoV, COVID disease, pneumonia occurs, right in the air tissue interface, we have cells called type 1 and type 2. Type 1 cells basically line the breathing tubes, the alveoli, and occasionally you see these type 2 cells, which are specialized cells producing various substances. And if you look on the right-hand side, you see where the expression is most for ACE2. The larger the circle, the more expression, the redder the circle, the increased number of cells that are expressing it. And you can see it's highly expressed in the nose, right down in the lower airway in the alveoli. It's not really expressed by the type 1 cells, but it is expressed by the type 2 cells. Next slide, please. And we know increasing evidence, these are all papers that are peer-reviewed and available, but not yet published, they're just online. We know that there's smoking, active smoking is associated with increased ACE2 expression in the nose and the lower airway, and this is a meta-analysis sort of pulling together a variety of data sets and looking at that. So active smoking certainly seems to upregulate this receptor. Next slide. And this just shows 2 pictures that have been published in the literature as part of an editorial. The upper part is a bronchial biopsy, so a biopsy from the slightly larger tubes, and you look at those brown spots, those are ACE2 type cells, lining cells. And if you look at the lower photomicrograph, you don't see any brown spots, and that's from a normal control. So there's some, you can actually see this visually, that this is from the smokers in the upper micrograph have higher levels of ACE2 expression. And therefore, you can imagine that these cells are going to be more vulnerable to infection, and essentially for the same infected dose, what you're going to get is a sort of increased amount of viruses entering the cell. Next slide, please. Conversely, this again is data in press, which I think is very interesting, showing that ACE2 expression in the nose of children is very much lower than adults. And you probably heard that children seem to be less vulnerable to COVID disease, perhaps less vulnerable to getting infection, but certainly in COVID disease. So we see that age is very important in expression. So I'm trying to, we haven't quite made the link, but there seems to be that lower levels of ACE2 will perhaps make you less vulnerable, higher levels will make you more vulnerable to develop an infection and subsequent disease. Next slide. And finally, this is just another impress from nasal brushings from children who are allergic. So if you're allergic, you seem to have less levels of ACE2, so that's a blue box. And you again might have heard that you know, asthmatics who we thought were going to be particularly vulnerable to COVID disease don't seem to be particularly. So maybe it's a feature of something to do with the allergy itself. Next slide. Okay, so what was our study? Before the lockdown, we were interested in collecting PM10, and we had on loan something called a cyclone, which was developed by University of Stirling, that collects dry particles. That's very helpful for our cell studies because we know exactly how much particles we put in. And on that right panel, you see what we collect. It's pretty black sooty and stuff. And given that Marylebone High Street is probably dominated by diesel vehicles, this is the sort of enriched diesel soot, essentially. Certainly, mainly traffic-derived particles, carbonaceous. Next slide. So what did we do? Well, the top part, we just take the cells. We have two types of cells. One from a brushing from a healthy individual who are grown. We grow those cells in the lab to a layer. And then we use another type of cell, which is a lung cancer cell line, which models the type 2 cell. But we grow those to a monolayer, a layer in a sort of a plastic container, and then expose them to particles for a period of time, in this case for 2 hours, wash off all the particles, stain the ACE2 receptor so it is fluorescing, and the amount of fluorescence we see and can measure using a flow cytometer, as you can see in that left-hand panel, reflects the amount of receptor that is being expressed. And we didn't really know what to expect. There's no evidence that PM10 or air pollution upregulates the receptor, and so we hypothesized that it might do, but we didn't have any preconceived ideas what would happen. Next slide, please. So what are the data? Well, this is the data for the type 2 cells. These are the A549 cells that are lung cancer. They're sort of immortalized for various doses of PM10 for 2 hours. And if you look at the left, you see a control. We see very little ACE2 expression in just the normal cells. But when you add in PM10 for 2 hours, you get an significant increase in expression, becoming statistically significant, around about 10 micrograms per mil, and sort of greater at 20 micrograms per mil. And we chose for subsequent experiments 10 micrograms per mil. It's actually lower than the concentrations we usually use. We usually use 40, 50 micrograms. So 10 micrograms per mil for subsequent experiments. Next slide. So if you just focus on the left-hand panel, this is a repeat. Again, all of these are separate experiments. The repeat for the type 2 cells, we repeated those experiments with 10 micrograms, and we show a highly significant increase. So, hardly anything going up to maybe 10,000 units. So, sort of at least an order of magnitude increased. And then on the right-hand panel, that B panel, we see the nasal epithelial cells from a normal control healthy adult. Again, we could induce ACE2 expression by exposing those cells to PM10. And as a possible potential or putative positive control, and we heard that smokers have increased ACE2 expression in their airways. This is message. This is the sort of genetic expression as opposed to sort of the protein on the surface. We did include our standard mixture, which is cigarette smoke extract. So the next slide shows what happens when you put cigarette smoke extract. Could you have the next slide, please? So this is CSE, cigarette smoke extract, 5% diluted cigarette smoke extract from Marlboro cigarettes that we smoked artificially. And using the A549 cells, we again could induce ACE2 expressions. So next slide. So what does this show? So this should say that these data at the moment are in preprint and they're not yet published in the peer-reviewed literature, but we, I think, showed pretty convincing evidence that in the laboratory we can induce ACE2 expression by exposing cells to PM10. And the next experiments we hope to do when lockdown eases somewhat is to actually infect those cells with SARS-CoV-2 and see if that translates into increased viral load in those cells, but it'd be very surprising if that was not the case. And secondly, that these sort of cell culture models, although there's quite a lot of limitations in terms of what do they reflect in real life, I think are quite helpful to screen out a variety of inhaled air pollutants. And you can imagine some of the things that we might be interested in, which could be particles from, I don't know, the London Tube, or particles from, or extract from e-cigarette vape, or heated tobacco, and all sorts of other things like that. And these things are on our radar to do over the next few weeks. Thank you very much.
Thank you very much, Jonathan. That was fantastic. Now straight over to York University, where we have Alastair Lewis, Professor of Atmospheric Chemistry and Chair of the Defra Air Quality Expert Group. So welcome, Alastair, over to you.
Okay, afternoon, everybody. So I'm just going to give a handful of slides that summarises some of the science that's emerging on how air pollution has changed over the COVID period. And this is obviously something that's had widespread reporting. It's been one of the few aspects, I guess, that you could mark up as good news, if you like. And it's been a component that's given us some foresight of what air quality might be in the UK in the future. It's been an unprecedented perturbation experiment. And to address this, because there was such a lot of activity and reporting on the change in air pollution, particularly in the very early periods of the lockdown, Defra sent a set of requests to the Air Quality Expert Group, which is a government science advisory committee, asking if we could collate evidence on how air pollution emissions had changed, how concentrations had changed. And it's to provide some initial learning, if you like, on how the atmosphere has responded from such a large change in emissions and behaviour. And actually, this is quite a complicated thing to do. The atmosphere is very complicated and the number of polluting sources is very, very wide. And so I'm just going to give a couple of examples here of some of the emerging science that's coming from this. And actually, before we start, you have to kind of set the changes that we've seen in context. And on the left-hand slide, the left-hand side of this slide is a graph that's been shown quite regularly at the daily government briefings, and that's the changes in transport patterns across the UK. And transport is one of the sectors where actually we have very good real-time data, so we can track, day to day how car use and so on is altering. But actually, transport is an exception. So we know a lot about transport and potential changes to emissions, but it's quite unusual. There are many other sectors of pollution where we don't have anything like this quality of data in real time. And so coming up with conclusions on what has changed is a little bit skewed to the data sources that you have. But obviously, we have seen big reductions in road transport, and they are major sectors for contributing emissions of nitrogen oxides, volatile organic compounds, and particulate matter. So we would be anticipating changes in those air pollutants in the atmosphere. The other component that's context is the climatology, and that's the weather. And so I've been regularly asked, as have many atmospheric scientists, how different is pollution now to how it would have been under business as usual? And it's actually quite a difficult question to answer because it's highly dependent on the weather. And we've had very, very unusual weather so far in the UK in 2020. We've had probably the windiest and wettest period on record in February, and windy, wet weather is generally pretty good for air quality. It flushes the atmosphere out. And since then, we've actually had very significant numbers of easterlies associated with the good weather, which brings in pollution from the continent. So answering the question, how much better is it now we're not driving around as much as we were, is complicated by these factors as well. So these have to be unpicked, and this is what we're doing at the moment with this evidence review. Okay, let's go on to the next slide. So this is one of the pieces of evidence that was submitted from Ben Marner from Air Quality Consultants, was this fantastic, very, very colourful plot. And to explain to you what you're looking at here, there are about 225 monitoring stations in the UK that report their data in real time to Defra and to the devolved administrations. And the top plot is essentially the raw data coming out for those individual sites. And it's very noisy and it goes up and down. So red periods are when it's polluted and so on. So the stripes that are on the right-hand side are actually all from urban locations. And as you move further across to the left, they become more rural. And it's very noisy and actually quite hard to spot signals and change during lockdown. That's marked with the red line, which you can just see with some red text. If you take out the weather, and there are statistical methods for removing the weather from this data set, you get the bottom plot. And then you can see very clearly the red line and the before and the after. And this is showing that there have been very, very significant drops in nitrogen dioxide in the UK, right across the country. So you can see, I don't mark all the individual locations on, but this goes everywhere from the south coast of England to the north of Scotland, and includes Northern Ireland as well. And you can see we go into a period where nitrogen oxides, once you correct for the weather, has fallen quite significantly. With the one exception right over on the left-hand side, which is that some rural locations have actually increased slightly. So we have seen very, very big reductions in nitrogen oxides, and this is what's received quite a lot of reporting. And it's very, very closely tied to emissions from vehicles, which are one of the largest sources of NOx. So in a way, there are no surprises here, but once the weather's taken out, the scale of the effect can be seen. And at the moment, we're thinking that what we're looking at during COVID levels of transport is really what the urban atmosphere might look like in something like 2030, when we expect quite a large fraction of those vehicles to have left the fleet and been replaced with cleaner ones. So it's a little picture of the future for nitrogen oxides for perhaps the world in 2030. Okay, let's move on to the next slide. And nitrogen oxide is a very clear signal, but of course what's been talked about in the previous two presentations is the links to PM2.5, which is the pollutant that probably causes the most harm to health. And PM2.5 is quite a long-lived pollutant in the atmosphere, and it's moved around between regions, between countries and so on. And so discerning a change between before and after is actually very complicated. And in fact, if you look at this in purely numerical arithmetic terms, pollution for PM2.5 has in many places been higher during lockdown than before. But this is actually dominated by the fact that we've had predominantly easterly airflow. So you need to do quite a lot of digging. And in fact, you need to combine together computer models along with observations to try to come up with a counterfactual, to try to come up with what would we have experienced in the UK if we had business as usual. And these are the two plots we have. So the pink is, if you like, the control, which was business as usual, and the darker red is the 2020 actual. So what you can see, there's about a dozen locations here. I'm afraid the writing's too small, but these are scattered around southeast England and the Midlands. And you can see that for many locations, PM2.5 has been of the order, perhaps up to 5 micrograms lower during the lockdown than we would have expected if we just had a business as usual March and April. But if you begin to dig into the detail and say, well, why is it lower? You actually discover that the story is quite complicated. It's lower not just because of lower emissions in the UK, but it's lower because of lower emissions right across Europe. And there's probably even a very small signal in here associated with lower emissions even from North America as well. So it's a lesson here that we can reduce PM2.5. It's quite a difficult pollutant to reduce because it's non-linear and it's long-lived. But if you get large perturbations to emissions and you do that at a regional scale, so right across Europe and the UK, actually very meaningful concentration reductions can potentially be achieved. And some of the previous plots and the previous presentations have shown that small amounts of PM2.5 is potentially quite significant. So we have got evidence emerging that PM2.5 has been lower if you were to compare it to a business as usual. Okay, let's go on to the next slide. One of the things that matters, of course, is exposure, not just what the ambient concentrations are. And this is some initial work that's been submitted to the evidence review from King's College London. And this is just showing that actually your behaviour has quite a big impact on the exposure to pollution that you receive. And there are 3 graphs for 3 different sorts of people: children, tube users, drivers, and hospital staff. And the black lines show the distribution of exposures that those different groups might have expected under business as usual before lockdown. The blue line is the exposure they experienced under lockdown, and then the exposure they would have received for PM2.5, assuming perhaps they were indoors with an hour of extra cooking per day. Now, we don't know for sure that everybody has had an hour of extra cooking per day, but it gives you an idea or a feel, if you like, for the sensitivity of people's exposures. So before and after lockdown, you can see here that there's a general reduction in people's exposure, and a lot of that for London is associated with less commuting, less time spent in polluted locations. But indoors isn't necessarily a perfectly clean location, and you can see that if we add in an exposure for an hour of extra cooking, the graph moves to the right-hand side and exposure begins to increase again. So although we are getting reductions in outside pollution, we're also becoming aware that there is evidence that time spent indoors is potentially polluting if, for example, indoors is also associated with activities like cooking and burning and so on. So it's quite a complicated picture, and there's more to reducing exposure than just reducing exposure outside. Okay, just on to the final slide. Whilst we have seen reductions in nitrogen dioxide, and that's visual, you can see it by eye, they've been very dramatic. There are likely to have been reductions compared to business as usual for PM2.5 if you throw enough, if you like, computing power at the problem. There is a third pollutant that we generally think about as causing harm, and that's ozone. And ozone responds in rather unusual ways. It's a secondary pollutant, and we have had some submissions to the evidence review on how the atmosphere will respond to lower nitrogen oxide emissions, but all other emissions remaining constant. And so we have some forecasts that tell us that potentially just reducing nitrogen oxide emissions from road transport can potentially lead in both springtime and summertime to higher concentrations of ozone. And this really is to emphasize that some of the secondary pollutants like ozone and PM2.5 need all sources of pollutants managing together. So whilst it's great to remove just, for example, vehicles from the road, and that reduces NOx very significantly, if you don't reduce some of the other sources of pollution and other chemicals like volatile organic compounds, actually quite perverse outcomes can arise. And in this case, it's actually possible for one pollutant to increase, even though other pollutants are decreasing. So I'm going to sum up there. It depends very much on which pollutant we're looking at. There's a huge amount of academic work going on, and I think there's an enormous amount of learning that we're going to get from this lockdown on the feasibility of air quality targets in the future, on how the atmosphere will respond to different emissions, and how perhaps behaviour change may lead to different exposures and make us think a little bit more, for example, about our exposure in homes as well. So I shall stop there.
Thank you very much, Alastair. That was fantastic, showing this is a very complicated, multivariable exercise. We need a holistic approach. Now, I'd like to turn immediately to the collation of proposals that have been put forward by academics, businesses, MPs in the air quality strategy to reduce coronavirus infection. It basically tries to confront some of the problems we've listened to. So we can move straight on to the proposals. You can all, if we go back to the principles just for a moment. Just go back one. So just to set the scene, what we've tried to do here is have a science-based approach that is holistic, that we're looking at all the various variables we've been talking about. Obviously, we appreciate there's a greater concentration of pollution in urban areas, but we need a holistic approach that looks at the various things that have just been mentioned, including agriculture, and obviously an inclusive approach, and there's mentioned in the Harvard study about the BAME community, and of course the fact that poorer communities are hit harder, partly because they're on the front line of production and interface with more and more people in more cramped living and working conditions. And obviously we want a realistic approach that can be taken virtually immediately with a mind to the most cost-effective solutions. So moving on to the next page, in terms of the economy, I think a few years ago now, the Royal College suggested that air pollution in Britain alone was costing something like £20 billion a year. Much of that, of course, is in terms of health. There's a lot of talk about having a green renaissance, a trajectory out of COVID that changes the way we work and play and live. And this air quality strategy must form part of that. So moving on to the proposals, there's a number of sets. The first set of proposals are for working and briefly focus here on more remote working, more digital connectivity, the idea of staggering businesses and school hours so there's less congestion on public transport and less pollution, average pollution, and less transmission of COVID. Flexibility in terms of furloughs. We've got a very strict furlough now. Either you're furloughed for a week or whatever time it is, or you're working, and obviously we could have a part-time approach to that. We need businesses to come forward with credible sustainability plans and think about how construction and other industries basically use less polluting machinery and indeed offer opportunities for workers, whether it's on IT training or learning to live more environmentally friendly in the new world. The second set of proposals are, I'd say there's a quote there from the Prime Minister signalling that he's a proponent of cycling. But moving on, obviously we do want to live in terms of our proposals, in an environment where it is safer, both from being knocked down and inhaling toxic air, to cycle. And clearly there's been initiatives already in London about creating more space for pedestrians, for cyclists, making it easier to do that and to move forward. Next, the third set of proposals is about public transport. Clearly there's a concern that if we all go back to work and avoid public transport and get in our cars, then clearly there'll be more pollution. So there needs to be confidence and safety in public transport. Some of that is about more frequency, more social distancing, mask wearing, testing, and support obviously for public transport that doesn't emit diesel, that's electric and hydrogen, and greater connectivity generally of public transport that's safe. In terms of private transport, a fourth set of proposals are basically about ensuring the emission zones continue to be rolled out outside London and enforced, and we use fiscal measures to incentivize people to use public transport and clean transport, don't have non-essential travel, roll out the infrastructure, introduce scrappage schemes, convert more quickly diesel taxis, and basically have a fiscal strategy in terms of excise duty to encourage people to buy cleaner vehicles and to bring forward the date at which fossil fuel geared vehicles will be abolished from 2035 to 2030, and also look at things like air traffic, etc., both in volume and qualitatively in whether it can be cleaner. The fifth set of proposals are about masks. Obviously, there's been a lot of controversy about masks, but put simply, we know that you're less likely to spread COVID through coughing and speaking if you've got a mask on. You're less likely to catch it by touching your mouth if you've got a mask on, if it's on a handrail or whatever, or a button. And it is so it is the case that masks do work to a certain extent, and clearly masks do protect people from particulates in terms of diesel emissions. And as was mentioned by Queen Mary's, that means that your ACE2 are sort of kept down in terms of being able to receive infection. Moving on to the next slide. It hasn't been enough said about wood and coal burning, which is nearly 40% of PM 2.5. And clearly we do need to accelerate the rate at which certainly wet coal and wood is burnt, and basically to drive out this sort of burning, both in urban environments and and more widely. We also need to think about bonfires and fireworks as well. The seventh set of proposals are about agriculture. Obviously, we're very dependent on agriculture here, in particular under COVID. Farmers have produced our food to feed the nation, and they face the uncertainties of Brexit. But at the same time, we do need to audit what the impact is, whether it's ammonia producing secondary particulates and PM 2.5, and think what action we can take there. The eighth set of proposals is home delivery services. Is just about industries and retailers working together to reduce the aggregate amount of movements in terms of the delivery of our goods in a sort of cooperative or regulated way. The ninth set of proposals is, there's a quote from Stephen Holgate just before then. I think for us, Stephen Holgate for the Royal College is with us today, and they've done extraordinary work. This is the Royal College of Physicians on indoor air quality. And as was mentioned by our last presenter, there's an issue of people moving indoors and perhaps being captured by different forms of air pollution, some of it which is about cooking, some of it's about the sort of chemicals we use on ourselves, and cleaning chemicals, what's in our construction materials. And these chemicals that often actually have a cocktail impact with outdoor air pollution can have inflammatory impacts on people's lungs and hearts, and give rise to greater, propensity to being affected by COVID, apart from anything else, as well as dying prematurely. So there's a big agenda here to actually regulate, what we're subjected to, and inform the public, and provide more ventilation in people's homes. And of course, that includes issues around damp and mold, and burning candles and so-called romantic dinners with triple glazing, not knowing that you're inhaling a lot of bad air. The 10th set of proposals is just, the idea that this is part of a wider map of delivering a sustainable industry that will act as a platform as well for green exports for the UK and elsewhere. And finally, we've got the issue about data collection research, and we've already heard some of the rich data research that's going forward, the complexities of those, the needs for correcting in terms of the weather, other chemicals, the demography, and the disproportionate impacts on certain sectors of the population, how we explain them. And there's been some reference already about those people who are poorer at the front line, how they're exposed both to pollution and COVID. And of course, that's correlated very closely with the BAME communities. Is there another slide beneath this? Obviously, the Mayor for London is doing his bit, taking this very seriously. It's very high up the political agenda. And in Britain, of course, we've got the Environment Bill coming forward. The Environment Bill should be sort of decided by the summer. And so it's very important now that we actually strengthen it. It's supposed to be a vehicle for providing a new tomorrow. But in fact, at the moment, at least, we haven't got strict enforcement agencies to deliver air quality limits that many of us would like to see in terms of the World Health Organization standards of 10 micrograms per cubic meter PM 2.5 delivered by 2030. And so that people are accountable, we are actually delivering these. And also we include indoor air quality in the Environment Bill. At the moment, the Environment Bill only consists of the outdoor environment, and yet 90% of our time pre-COVID was indoors. And of course, since COVID, a lot more of our time is in our homes. And some of that time, as has just been pointed out, are spent cooking and in an environment we assume is safe, but perhaps is not. So I'm going to open up now for this final slide, I think, that simply says #clean. There's a bibliography. This will be published as a bibliography. Lots of interesting reading for people to look at. And on the back page, I think we've got Clean Air, Act for Clean Air. So if you've got any comments or want to promote what we're doing, so we have a cleaner, safer, more healthy future, do go ahead. Now I'm going to turn now to a number of questions that people have put forward, and invite our panelists to perhaps have a crack at some of these. And I think I've got them on my phone. Yeah, so yeah, hold on. sorry about this. I forgot the, so I'll just get it up on the Q&A, I think. Someone was simply asking about the higher incidence in urban areas. So we'll move to the. Can we just have a reminder from the Harvard team about? I think the predictions about 8% reduction in COVID deaths associated with the 1 microgram change in PM2.5. I think changed from the original forecast of 15%. And I was wondering whether we could have possibly an explanation for that. I think we've had a couple of questions also about the BAME community, whether there's any explanations for that. Somebody's asking, I'll ask a series of questions and speakers can come back, pick and choose what they want to answer, about PM2.5 and PM10. People are asking whether there's been any consideration of the ultrafine particles below that. And I think we know from research from Craig Archer that the particulate filters in lot diesel cars actually crush up particulates, making them to even smaller particles that are belched out every 300 kilometers or whatever. And there's a real concern now if our only targets are PM2.5 that the manufacturers will convert PM2.5 into PM1.25 and kill more people and get away with more. So I'll just check whether there's a couple more here. If anyone wants to make any comments about indoor air pollution, that would be very welcome. And finally, I think there's some suggestion that there's the NOx levels in the southeast are a lot lower than so a lot higher. They're a lot higher in the northwest, and whether anyone can give an explanation for that. Perhaps it's a question for Alastair. So can we start off perhaps having a crack at some of those questions with Rachel and Xiao, then we'll go on to Jonathan and then Alastair, if that's all right. Over to you, Rachel, if that's okay. Thank you. I can't hear you, Rachel. I think Rachel needs to be unmuted.
Okay, hi. Am I unmuted now?
Yeah.
Okay, hi. Yeah, thanks. So I think your first question had to do with population density and urban areas and how that could bias the results of our study, because coronavirus has primarily had large outbreaks in highly populated areas, densely populated areas that are also tend to have higher air pollution levels. And I think, so that's sort of adjusting for those types of factors in the statistical modeling is sort of what we do as biostatisticians and epidemiologists. And we have done our best with the available data to account for population density. So these models that produced these estimates are adjusted for population density. So you can think about them as comparing the effect of a 1 unit increase or decrease in PM2.5 in 2 counties that are otherwise identical, so that have the same population density. So we're trying to sort of control for the effect of population density. Admittedly, the data still aren't perfect, and so I think one thing that we're asking for here in the US is better data, so that we can try to parse through those different possible effects more clearly, because there is still some chance that presents some bias in our study. We can never fully be 100% sure that's erased, but the better data that we have and the more high resolution data that we have, the better we can do. So we're hoping that better data will come and we can validate this in higher resolution data.
Thank you. Did Xiao want to add to that?
Okay. Yeah. I think I can mention 2 more points. One is that we also did the sensitivity analysis that only look at urban area and the rural area separately, and we find the effect size for those counties, considering county that's only rural and the county that's only urban, the effect size are about the same. So this could potentially explain whether there is a rural or urban difference. And also we did study by daily, because we can know that's actually in United States, the pandemic is still going on. So actually more and more rural area become epicenters in recent days. But we run the analysis day by day and we find the results are really consistent. So this might partially also explains that maybe this result is consistent across the whole country.
Can I ask you, Xiao, somebody's asked about whether ammonium nitrates and sanctuary particulates have the same sort of impact as, you know, normal PM 2.5 from vehicles in terms of, you know, the effect on COVID and generally. Is there any way of breaking that out or not really?
Right now, I mean, in our preliminary study, no, because we don't have the source for the PM 2.5. So we don't have this data. It's definitely an interesting question that's need to be further studied.
Right. Now over to Jonathan. I don't know whether you've got a sort of a thought about that. I know most of your PM 2.5 are clearly from diesel in the roads you're studying, but over to you, Jonathan.
I mean, two comments. I mean, the material that we use is formed of aggregates of ultrafine particles. So if you look at an electron microscopy, you see tiny little spherules of carbon. So these are not big chunks. Most of it is tiny little things aggregated together. Very difficult to look at ultrafine particles on their own. One comment, though, is that the ultrafine particles, the free ultrafine particles, when just existing free in the atmosphere and breathed in, have an increased chance of actually getting across into the systemic circulation. And we've got increasing evidence that that's happening to some extent. And we know that, for example, ACE2 expression exists in the heart and other organs, kidney and liver and things like that. So, I mean, although these are very low concentrations getting across, we need to, that's another mechanism which we shouldn't ignore. In terms of particles being equal, this is an endless problem. Epidemiology will tell you that very, very difficult to separate that. I wish I could get some secondary particles to use in my experiments, but I can't. So I can't comment. I strongly suspect that particles are not equal, but I can't prove it yet.
Right, thank you. And Alastair, are all particles equal, or some more equal than others? Alastair, are you there?
Yeah, I'm here. I mean, it's a good question. I mean, particles are a sort of dumping ground for chemicals. If you look inside them, there are hundreds of thousands of different chemicals that are there. I mean, we very rarely breathe particles of just one type. That would be quite unusual. If one looks at the kind of toxicology of them, you find studies that go one way on one type, and another study looks at the same chemicals, finds a different conclusion. So at the moment, we are a bit hamstrung in not having much consistency in terms of how lab studies determine which are the more harmful components. And then we run into a data problem that we don't routinely measure what our particles are measured of. It's quite cheap and straightforward to measure PM 2.5 overall, much more complicated to break it apart and say what it's made of. So we are, I suspect, for the foreseeable future, just left with this bulk measure of PM 2.5.
Supplementing to that, I think you did mention in your presentation about the possibility of pollution sort of blowing in from Europe, and obviously across the United States, it'll be the case as well. If one city or county or state takes firm action, it is possible for things to blow around. I mean, how important is it to have a joined up approach to this? And obviously unilateral action is helpful, but
so
what's your instinct?
So it's becoming more and more important. I mean, when air quality was absolutely terrible in the UK and we were burning coal fires everywhere and so on, you could do an awful lot about improving air quality by getting your own house in order. I mean, that was clear. Air quality is a lot better than it was. It still isn't perfect, far from it. But as you get your own house in order, the effect of the transboundary component, the amount that comes in from different regions, and that could mean the city next door to you or the country next door to you, grows in significance. And so if we're going to move towards more challenging targets in the future, for example, meeting the World Health Organization recommended limit at the moment of 10 micrograms, the component that comes in from other places, it becomes significant. And indeed, the natural component becomes significant. Even if you live on the west coast of Scotland in a gale, 1 or 2 micrograms of particulate matter is blowing in. So there's a lot that can be done at a national scale, but as air quality improves, no matter what country you're in, the ability or the need to work internationally becomes more and more significant, in the same way as we work internationally, obviously, on greenhouse gas emissions.
Right. And now I was wondering, we're going to have to wind up in a moment, but I was just wondering whether any of the panelists might want to, I've been through a lot of proposals, we've talked about a lot of research, and perhaps people could focus in on what they think may be, most important few actions we can take to help indoor and outdoor pollution, of course, most importantly. Can I start with Rachel again?
Yes, you can start with me, but I think I'm probably not the most knowledgeable about what specific actions are best for reducing different pollutant types. I feel like the other folks who work more on the transport side might be better for that.
Right. I guess the main point of the research is to highlight the fact that there is this association, there is this danger, and something must be done, which is very much put it on the map. I don't know, you didn't want to watch, did you want to add anything, Xiao, or not at this point? I mean, obviously, the research is groundbreaking. We're very grateful. Is there any, Jonathan, was there anything you wanted to add, or just not really? Oh. Yeah,
I think it's this natural experiment, terrible cause, of course. We've dramatically reduced individual exposure. I mean, it happens in the summer, so indoor air pollution, where our houses are well ventilated. So we really need to understand what the potential benefit was that. Clearly, there's delay in diagnosis and various other things, but it should be possible to work out whether we see a dramatic benefit on, for example, strokes and MIs, as well as asthma attacks, which could be a result of better hygiene. And as a complex intervention, we really need to understand the benefits, and clearly there are significant benefits in other areas.
Thank you very much. And finally, Alastair, did you want to make any final comments about the need for action?
Yeah, I mean, I think we should be in a way encouraged that we have seen substantial reductions in some air pollutants as we've taken cars off the road. I think people can see now what is possible for certain pollutants. I think rather than the benefits coming ahead being somewhat theoretical and occurring in perhaps a decade's time, we've had some taste that actually we could get those benefits quicker, and that we can see clearly that some pollutants would improve if we took action. And I think, to me, it just reinforces on, particularly for PM 2.5, the need for both national and international action. And I say when we get to the final end of analysing this event, I think we may discover just how powerful coordinated international action to reduce pollution actually is. And when we begin to compare what we've experienced versus what we would have had under a business as usual, we'll discover that international cooperation is a phenomenally powerful tool in trying to improve pollutants like PM 2.5 and ozone.
Thank you very much. Strange enough, I was elected onto the delegation for the Council of Europe this week, and had previously been the air quality rapporteur. So I'm very keen, like you are, to spread the faith, and it's very good to be joined by people from Harvard today, of course. And I would encourage all those who've been involved in this meeting to keep on promoting an action plan to have a new tomorrow, which is similar in air quality to the advances we've made today, and to keep moving forward. So do tweet on, hashtag Act for Clean Air. You'll all be getting a copy of the presentation in terms of the strategy, and hopefully I don't know whether I'm right to say, but in terms of the presentations we've seen from the speakers, can I assume that we can get copies of those and send them to all the people who've been attending this? And I think we want to keep this conversation going, and I would encourage you, of course, to write your MPs or your democratic representatives in the United States to keep this on the agenda, to keep the focus on this, so that action's taken to create a healthier greener future for all of us to share. So on that note, thank you so much for coming along. It's been a really great meeting virtually, and look forward to seeing you all again on my screen, if not in the flesh at some point. Okay, thank you so much. And perhaps with that, I can say goodbye to everybody. And thank you so much. Meet you again. Adios.